Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I'm a member of the International Progressive MS Alliance Scientific Steering Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. I'd like to acknowledge and thank today's national sponsors, SureScripts and Walgreens. Support from MS community partners helps the National MS Society reach its goal of providing up-to-date information and support through programs like Ask an MS Expert. And thank you to all of you who are joining us on GoToWebinar, Facebook Live, YouTube Live, and Twitch. The MS Society's Ask an MS Expert webcast is designed to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. So as I chat with our expert today, please feel free to post your questions in the GoToWebinar chat box. We'll try to answer as many of those questions as we can during the Q&A portion of today's program. And the Society's MS navigators are also online throughout today's program, answering questions and connecting you with resources. Many people know that they can talk to their doctors about their health and how to manage it. But did you know that pharmacists do more than just fill prescriptions and are also a great source of health information? A pharmacist is an important member of your healthcare team, and with nearly 9 in 10 Americans living within just 5 miles of a community pharmacy, your pharmacist may be the health professional you see most often and talk with about your health. Today, we're talking with pharmacist Dr. Ross Tingen about the many ways your pharmacist can help you manage your health. Dr. Tingen is a clinical pharmacist at VCU Health Multiple Sclerosis Clinic. Dr. Tingen began caring for people living with MS in 2017. She's served on several national MS Society committees, and she's been certified as a multiple sclerosis certified specialist by the Consortium of Multiple Sclerosis Centers. Welcome, Dr. Tingen, and thank you for being with us today.
Thank you so much. I'm so happy to be here.
Before we get started, I'm curious, Dr. Tingen, what was it that put you on a path to becoming a pharmacist and then specializing in working with people living with MS?
So, I decided to be a pharmacist when I was in high school. I loved the medical field and grew up with a mother as a nurse, but really enjoyed chemistry and the complexities of pharmacy in itself. The story to become an MS specialist is a little bit more convoluted. Started my training as emergency medicine with a focus and interest in neurology. The MS side actually the opportunity came up in like 2017 and is so near and dear to my heart. It's been really great to work with a very dynamic disease process and wonderful patients. And the fact that every patient is so different and all medications are so complex, it is just been something that I've been very fortunate to come into.
I mentioned a moment ago that pharmacists are an important member of a healthcare team, but everyone may not be fully aware of what goes into becoming a pharmacist. So how much education is required to become a pharmacist?
Yes, so typically it is a 4-year bachelor program that then goes into a 4-year doctoral program. After that, pharmacists you'll get your PharmD, and there's a lot of different pathways for pharmacists after that. One of which can include residency training or specialized training after that.
I think I was going to ask a question close to that, wondering if you had to complete clinicals or fellowships like other health professions.
Yes, so we will go on to, there's a whole section of pharmacists that can do a PGY1 or a first-year residency to specialize in a variety of different areas, most commonly in the pharmacotherapy group and inpatient. And then after that, there is a second-year specialty that you can do, which is a little bit more focused. There's not very many in neurology. There's a lot of like critical care or ambulatory care, but there's multiple different avenues to continue their education.
So pharmacists can specialize in one particular area like a doctor would specialize in neurology, for instance.
Yes, they can. It's, it's a different type of training and it's a shorter residency, but yes, it can be very focused.
You're an MS certified specialist. Can you tell us what that means?
Yes, so it is through the CMSC, and what it is a certification that is for allied health professionals that care for people living with MS, and it is a designation that shows that you have a comprehensive knowledge of the needs of those patients. This can apply to physical therapists, occupational therapists as well, can apply for this certification.
How common is it for pharmacists to specialize in MS care?
Yes, there are not many pharmacists in MS care. It is growing. And so I wouldn't say it is very common at this time, but I think it is continuing to grow.
Is there any sort of difference between pharmacists who work in a hospital setting and those who work in a local pharmacy?
Yes, the training is different. So, in a hospital setting, there are pharmacists that ensure drug safety, as in they make the medications and they check the medications and make sure everything is getting to the right patient at the right dose. There's also pharmacists that are, on the floors practicing clinically. And so that's a whole different set of training. The community pharmacists are, front line, checking medications, making sure there's no drug interactions. So there's a difference in the skill sets and the difference in their training as well, and the services that they provide their patients.
Beyond just working with patients, do pharmacists also work with other healthcare providers?
Yes. So for instance, I work directly with 2 physicians and multiple other physicians outside of the clinic space. I work with our nurses, our social work. We have a pharmacy technician on our team and all other sorts of health professionals that we need to use. And so it's very common for collaborative care.
We heard from Lindsay, who wrote in saying she was surprised a few years ago when she went to her local pharmacy for her flu shot, and that shot was actually administered by the pharmacist. Obviously, over the last couple of months, we know that pharmacists are also very involved in providing vaccinations for COVID-19. So when it comes to patient care, is a pharmacist's role expanding now?
Yes, I would say that it has been expanding. Every state's a little bit different on what they can offer, but pharmacists, especially in the community setting, offer a very unique, and as you mentioned earlier, a very accessible touch point for patients by, they do some testing. So there's some pharmacies that are actually doing even COVID-19 testing. There are vaccinations, health clinics, and there's diabetes management, hypertension. So there are a lot of different roles that are expanding for patients to have better access.
I'm almost tempted to ask you what other services and care do pharmacists provide that we may not know about?
Yes, so there's a lot. I think that, sometimes pharmacists, especially in the inpatient side or the clinic side, are a little not necessarily as front line and know that they're doing, not all patients know that so many pharmacists have touched their medications or done safety monitoring. And so they're kind of, if you're inpatient, you are in the hospital, there's a pharmacist reviewing your medications for safety and drug interactions. They're also a pharmacist making sure that if there's an intravenous infusion is being made correctly. So all along the way in the inpatient side, and then from the outpatient side and ambulatory care clinics, their specialty pharmacies, which I'm sure we'll get into a little bit later, have clinical pharmacists that are ensuring, adherence. So it's a gamut. I think it's continuing to grow.
So does it make sense for someone to talk to their pharmacist if they are experiencing a new MS symptom or really any new medical problem in general?
Yes, I think that pharmacists are very apt to reach out to patients' providers and act as an advocate for their patients. Even though maybe a community pharmacist isn't as familiar with a specialty drug or the disease state in itself or the complexities, they are there to listen and advocate for their patients. The specialty pharmacists that are, dispensing a lot of the disease-modifying therapies are trained to educate on those specific drugs and can also advocate for the patient with the provider or any kind of side effects. And then you have, people like me who are in the clinic and getting phone calls and making some medication adjustments as well.
Well, before we continue our discussion, I just want to take a moment to welcome those of you who have continued to join us. Please let us know what's on your mind. Type your questions into the question or chat box in GoToWebinar, and we'll address as many of those questions as we can during the Q&A portion of today's program. And MS Navigators are online throughout today's program, answering questions and connecting you to resources. Our Ask an MS Expert program takes place at this same time every Friday. So please help us make sure that everyone knows about it by sharing news about the webcast with your family, your friends, and on all your social media channels. Since we're fortunate enough to be talking with a specialist today, let's focus our conversation for a bit on disease-modifying therapies. And maybe not everyone is up to speed on even that term. So Dr. Tingen, maybe you can help us by explaining what are disease-modifying therapies, or DMTs as they're known.
Yes, so disease-modifying therapies are FDA-approved medications that we use to modify the disease course of multiple sclerosis. Their primary goal is to prevent further relapse or prevent further progression. So the whole biggest point of that is the modifying part, so changing the trajectory of the disease process.
Raymond wrote in saying he doesn't think his disease-modifying therapy is working because he doesn't feel like his MS fatigue is improving. If anything, he says, it's getting worse. What can you help Raymond understand about his disease-modifying therapy?
Yes, I think it's really important to note that we have come a very long way in modifying the trajectory of the disease, but these medications do not necessarily help symptomatically. So there is a very comprehensive care that comes into these patients that are being treated, which can be fatigue management, but the disease-modifying therapy is going to be solely focused on what could and preventing additional disease from that standpoint. So unfortunately for Raymond, the fatigue would not actually improve or be expected to improve with their treatment.
We heard from Shania, who's wondering if all DMTs work in the same way.
So no, they do not. Again, we have 20 medications on the market, and a lot of them work in very different ways. And so some of them change the behavior of the immune system, while others can actually cause immunosuppression, or where we eliminate part of the misbehaving immune system. So, there's kind of two different general terms, but two different general ways to treat or use as a disease-modifying therapy. But the overarching thing to take home is each drug class works differently to kind of work that way.
And a question comes to mind as you were speaking. Someone may be listening to our conversation right now, wondering why, if there are just a few subtypes of MS, they're relapsing, remitting, secondary progressive, primary progressive, that's just 3. And yet there are more than 20 disease-modifying therapies. Why so many?
Yes, I think that's a really great question. What it comes down to is the understanding of the disease and the dynamic process, and that each person is different and their disease is different. And, we're pretty good at figuring out the inflammatory process, which is that relapse process, and different targets. But when it comes to a progressive target, we don't have nearly as much information. So as we get more and more data and we are able to make maybe different types of drugs that work for more aggressive or progressive patients. It's, I think technology changes, medicine changes, and the more information we have, the better drugs we can develop.
There are several different DMTs, as we just said, and there are a few different ways that they're administered. Can you talk about the different ways that disease-modifying therapies are administered and what may be some of the pros and cons of those various methods?
Yes, so we have three buckets of modification that we could do in regards to administration. So we have injectable therapies, which can be subcutaneous. So they'll be in the subcutaneous tissue, a smaller needle. And then there's a couple that are actually intramuscular. And some of the benefits of that are, some of them are only like 3 times a week or once a month or once every 2 weeks. And so the administration can be a little bit easier because you're not doing it every day. When it comes to our oral therapies, most of those are taken every day. Some are taken twice a day. And then some, there's, one other category that kind of goes into its own where it's taken once per year. So all of those to say each drug kind of has their own side effects, but it offers a lot of different options for patients in regards to the oral therapies. And then for intravenous therapies, some of the benefits are it can be given less frequently, and they can go to an infusion center, or some of them can get infused at home. So it really offers more of a tailored approach to what works best for the patient and the provider.
Paula says she was recently diagnosed with MS. Her symptoms, she thinks, are pretty minor right now. So she wants to know when the best time is to start a disease-modifying therapy.
So that's a really great question and is very personal. And so it is a decision, usually between the neurologist or neurology provider and the patient. We do know that the sooner you take medication, the more protection you have. And so being treated does prevent the risk of having a relapse and progression. But I think there's a lot of things that can go into the decision of when each specific person would make it that to go ahead and get started with treatment.
Do all disease-modifying therapies have the same side effects?
No, so they all have a very different side effect kind of profile that can vary on administration and how the drug itself works.
Are there any common side effects that people with MS may experience?
So, it's pretty kind of across the gamut. Some do cause some gastrointestinal upset or nausea. Some cause headache. Some can have injection reaction. So if you are doing an injection, there's always a risk of a reaction. During an infusion, there's a risk of an infusion reaction. And then the oral therapies, depending on the medication, can be really well tolerated from the beginning or take a little bit of time. So I do think it's really important to work with your pharmacist to kind of help mitigate those side effects the best you can.
That was going to be my next question. If a patient approaches you and says, gee, they're nervous about side effects, what's your guidance? What sort of recommendations can you make at that point?
I think the most important thing is reassuring the patient and going through kind of that drug specifically and what side effects that person has read about that they're most concerned about. A benefit of having so many drugs on the market does provide an entire range of safety concerns where, low safety risk or higher safety risk, maybe more efficacy. And so sometimes that means we space out the drug a little bit differently, take it with food, without food, pre-medicate if needed. So there's a lot of different things to kind of walk through for that person. But I think the most important thing is talking and figuring out which side effects are the most concerning.
Speaking of those safety issues, there are disease-modifying therapies that carry warnings and precautions. What do those warnings and precautions mean?
Yeah, so some of them, if you were to Google some of them and you get up the package insert, the clinical trials have to report every adverse effect The cautions or precautions are patients that have been identified in the clinical trials or concomitant diseases or situations where we would avoid certain medications. That doesn't mean we completely, you're precluded from being involved, but those are always things that we want to take into consideration. Do you have a low heart rate? Are there medications that we wouldn't want to use secondary to an event that occurred 6 months ago?
And are all of these warnings equal in terms of their seriousness?
So no, they're not. So some of them, as a precaution, they will mention in the package insert or as a clinician, we would say that maybe this is a drug that we just need to be more mindful of or add additional monitoring to while on that drug. And then there's some there is an actual contraindication, meaning that there is a bigger safety concern and we would not use it in people with certain conditions.
Ebony wrote in to say her doctor wants her to switch disease-modifying therapy because the one she's on right now doesn't seem to be working to control her MS. And Ebony doesn't understand how switching to a different DMT is going to help. She writes, if one isn't working, how or why will another one be able to control my MS?
I think that goes back to the fact that everyone's disease is different. Everyone's process and pathway of dealing with MS is going to be a different way. The benefit of having so many different drugs is it does allow us to attack the immune system or change the way the immune system is behaving in a different way. And as we learn more and more about the disease process itself, it gives us additional pathways. So if a patient didn't respond to one type of modification of the behavior of their immune system, we now have the option to try a different modification or an immunosuppressive therapy.
When I introduced you, I mentioned that you work at a comprehensive care MS center. So let's talk about the role of a pharmacist on someone's MS comprehensive care team. Can you tell us what a comprehensive care team is and explain your role as part of that team?
Yeah, so a comprehensive care team provides people living with MS access to multiple different providers and different access points. So whether it be physical therapy, occupational therapy, a clinical pharmacist, and their physician, obviously, or a neurology provider. My role within the clinic is focused a lot on medication safety, monitoring, also access. So I have a team member that also helps me with patient drug access. And then depending on the state you live in and the comprehensive care center, there are other clinical opportunities. So I also help with symptomatic management and can see people, in between visits to help adjust medications symptomatically as well.
Darlene wrote in to tell us that when she was diagnosed, she had some real concerns and was feeling nervous about managing side effects from her disease-modifying therapies and trying to fit the dosing into her regular workday. And Darlene's doctor had her talk to the pharmacist on her care team. So what kind of education and support would you provide to people like Darlene?
Yeah, so that is a great thing that I actually really enjoy doing is to improve adherence. There are multiple different factors that go into that. So trying to figure out what those barriers are, they can be very specific, whether it be, they work swing shifts, so they're night shift for 3 days and then day shift, trying to switch back to day shift can, alter that. Sometimes that is as simple as offering a pill box. Or there are occasions where there's some cognitive impairment, and so we may want to switch our roles or switch our medications to kind of accommodate the patient. So from my perspective, the biggest issue is trying to identify the barrier of their adherence and their concerns and trying to tailor that to the patient's need.
Sam wrote in saying his doctor recently started him on Tecfidera. His doctor had him sign some forms, and then he got a call from a pharmacist about a week later. The pharmacist went over the side effects that he might experience, what lab work he needed to have done, and then his pharmacist called back after he had started Tecfidera to see how he was doing. Sam wrote that he felt like he was a VIP. Is Sam's experience common?
I think that there is a commonality in part of Sam's experience. So most of these medications do come from a specialty pharmacy, which will increase their access, the patient's access to a pharmacist in the specialty pharmacy that knows more about those drugs. Additionally, I think, there's a role for the clinical pharmacist, like who's in the physical clinic space, to reach out and make sure that the drug is being well tolerated as well. So my hope is that that is the experience for every patient, but I think that there should always be at least one touch point with a pharmacist, whether it be from the specialty pharmacy or the clinical pharmacist in the clinic.
Just a minute ago, I heard you mention something about adherence to disease-modifying therapies. And as we know, people with MS can struggle trying to take their medications as prescribed. What are some of the barriers to adherence that you see in your practice?
Yes, there's a couple of different barriers. Some of them are adverse effects or side effects that they get. And so, if there are side effects, how do we help mitigate those, whether it be with a different medication or, taking it with or without food? The other can be cost access. And so sometimes adherence is actually based on the fact that they're having a really hard time affording their medication or navigating the very complex process that is to continue to stay on a disease-modifying therapy. Also, there are, other issues that come up, and I think that those are pretty tailored to those specific patients.
Every time I ask someone a question, there's a tiny voice in my head that whispers, there's probably an app for that. I'm wondering, are there apps or other tools that make adherence a little easier?
Yes, so there are some there is an app for that, and that's exactly right. And I'm sure if you look it up, there's multiple apps for each one of those things. There's an MSAA app that actually helps you to, actually put out a calendar. And I think there's a few other when I recently looked as well. Some of the pharma companies also have a specific app for injectables, and that will actually set an alarm on your, it'll ding you when you're ready the day for your injection. And so there's a lot of different ways to improve adherence and use technology to benefit that.
Tyrone wrote in, he said that he finds the lab tests that are needed for safety monitoring for his prescribed DMT, he finds them overwhelming. He knows he couldn't possibly keep up with it all, so he's putting off starting a DMT because of all that other stuff. Are there strategies that might help people manage the monitoring that's needed?
Yes, so one of the biggest things is to try to consolidate labs as we need them. So that is something that I think is really important. And when it comes to monitoring after starting, I think there's a benefit to try to see what is easiest for the patient, whether it be not going to their providers necessarily hospital. If it's a large hospital and the thought of driving downtown to park to get labs is kind of overwhelming, trying to find a facility that is most beneficial. And then, just ordering the labs that you need and trying to consolidate with either visits as well is something that we try to do to improve getting the lab work done and then also make it not so overwhelming.
Tanika says she's been working with a pharmacist to get her insurance company to cover the DMT that her doctor prescribed. She says it's been almost 2 months. So is working with insurance companies to get coverage for disease-modifying therapies something that pharmacists might do? And if it is, what's that process all about?
Yes, so that is a long, convoluted process, and it has very dependent on the type of insurance, no insurance, and coverage. And so one of the things that we have done and who I really lean on is our pharmacy technician. That person is responsible for doing the prior authorizations and helping to navigate the insurance side. One of the things that I do is kind of tie in the authorization with the kind of the pharma side, and how do we best leverage all of the different resources that we have to get people on drugs in a timely fashion. Some of those delays are secondary to not knowing how to navigate the system. And it can be very difficult because it is different if you have Medicaid or Medicare, or like federally insured versus commercial insurance. And it can get pretty muddy. So that is definitely something that a pharmacy team can help with.
We also heard from Roy, who was recently diagnosed with MS, and he's experiencing some additional symptoms. He's wondering whether his disease-modifying therapy might be interacting with some of the other medications and vitamins he's been taking. How can a pharmacist work with someone in their healthcare team to manage medication side effects and overall symptom management?
Yes, so it's really important when you are coming into clinic and working, especially with your pharmacist, setting aside some time to update all of the medications you're currently on, including any herbal supplements or over-the-counter medications, and then working with the pharmacist to identify any possible interactions. The other thing that can be really helpful is to kind of streamline your medications if there are quite a few, and how do we best take them to prevent adverse effects and identify which ones may be causing the issue.
Mark wrote in saying he sometimes forgets things and he'd like to keep track of how he's feeling after taking his disease-modifying therapy so that he can share that information at his next appointment with his treating doctor. Dr. Tingen, what are some ways Mark can keep track of that kind of information?
So I think technology also comes into that, because there's an app for that. So the MSAA app has a symptom tracker on there and a calendar. So if you were to take your disease modifying therapy and want to, cluster kind of your symptoms around there, some patients do have a notebook where they try to, every day make like a little note of how they're feeling that day after their disease modifying therapy, or in general, especially if they do have some memory issues. And it's also hard when you are being asked 6 months into your therapy, like, how are you doing? And if 3 months ago you had a reaction, it doesn't always come up. So that is definitely encouraged.
Someone wrote in, and I think they're actually providing a real world example of something you just talked about a couple minutes ago. Terry wrote in to say that she called her doctor to say that she was feeling really tired and was asking for medication for her fatigue. And before her doctor would prescribe something, he had her work with a pharmacist to see if any of the medicines she was already taking could be making her feel tired. And the pharmacist shifted the timing of her pain medicine, and Terry said she's not feeling as tired anymore. Is that an example of how a pharmacist can help someone manage side effects tied to their medications?
Yes, I think that's, something that we really try to do, is to optimize and make sure that nothing we're currently doing is causing a new symptom. And we also don't want to cause that symptom and then add a new drug to try to fix it. So that is something that, yes, a pharmacist can help do in regards to timing and administration.
Well, you've certainly shared some very helpful insights on how to best work with your pharmacist. What would you say are the top 3 takeaways that you'd like our audience to remember?
So I think the first is that your neighborhood pharmacist is highly accessible and has a lot to offer, including vaccinations and information of over-the-counter supplements, and can advocate for you as, be your advocate to your provider. I think the second is that it is hard to go on to a disease modifying therapy. There's a lot of things that go into that decision between you and your neurology provider, but having a pharmacist to help you, decide regarding which labs and access points should be highly utilized. So if you have access to a pharmacy team to help you navigate the complex web in which to start treatment, I would highly reach out to them. And 3, I think that, working together in a comprehensive care team and ensuring that everyone can help you, and being honest of what you need to do better, whether that be talking about an app for your symptoms, or if you're having a side effect to your drug, just really working with your provider and your provider's team to do that.
Thank you for sharing your expertise with us, Dr. Tingen. Now let's continue taking some more of the questions that our audience has for you. I think they've gotten the message that you can ask your pharmacist some questions. Rachel wants to know if you plan to start a new diet or exercise regimen, is that something you should tell your pharmacist?
Yes, I think, there are some interesting diets out there. And so it is important because some of them are, going to be calorie restrictive or very restrictive in certain ways, or they may have interactions with your current medications. Exercise is very important, and we encourage that to any patient, to get as much as you can and do what you can. But, at a certain point, we also don't want you to exercise yourself into fatigue or cause any additional issues. So, sharing that with your pharmacist and your care team is really important.
Jeff wants to know if he already has insurance coverage, is it worth looking into other prescription savings programs?
I am of the belief that you should look into every savings program in general. The cost of disease-modifying therapies and MRIs for many of our people realize it is very expensive. And so trying to take advantage of the resources available, I think, is completely the way to navigate those costs.
Rebecca is asking if she should worry about over-the-counter medications like Aleve and Tylenol interacting with her MS medications.
So there are a few interactions, and I think it is, again, kind of back to that whole part of just telling everyone what you're taking, even if it's an over-the-counter medication. Some drugs for MS do get metabolized or utilized in your liver. So taking Tylenol can affect that. Sometimes also taking a lot of over-the-counters can affect other symptoms, and so such as headache. And so just letting us know what you're taking, especially if you're taking it frequently. I think also utilizing your pharmacist to kind of ask what would be the general recommendation for allergy relief and how to appropriately take that is a really important resource to use.
And Sandra wants to know whether vitamins or supplements can have a negative interaction with MS disease-modifying therapies.
Yes, there's a lot of information out there on different supplements or herbals that you could use for the treatment of or to benefit MS. Some of them, do interact with drugs, and they've not been well studied. Some of them, change or affect the way the immune system is, which is important to know because people living with MS have already a misbehaving immune system. We don't want to aggravate it anymore or boost it in a way. So it's really important to let your neurology team know so they can help you make the best decision for you in regards to monitoring and medication selection.
Because of COVID-19, Molly wants to know if she could ask for a phone or video consult with her pharmacist instead of having to go to the pharmacy.
Always. Yes, I think that one of the unique aspects of clinical pharmacy, especially in the clinic-based setting or ambulatory setting, is that many pharmacists have already been practicing with using phone visits. So most of my visits prior to COVID were via phone, which provides increase in access. It's easier to get on the phone after we've met to chat through some problems. So I think most pharmacists in this setting are actually very comfortable with phone and or Zoom video platforms.
Aren't we all?
Yes, well, now we all are.
I want to thank all of you who submitted your questions today. And thank you, Dr. Tingen, for being with us today.
Thank you so much.
I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're getting is credible and reliable. So we'd like to share some resources with you, and these are resources that you can count on to be current and credible. Over the last 20 years, MS medications have transformed the outlook for relapsing MS. Yet many people living with MS can't access the medications they need. Learn about how you can advocate to ask Congress to pass legislation to lower high drug prices and out-of-pocket costs by going to nationalmssociety.org and searching on the term medications. I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living well with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. And I'll also remind you that the MS Society brings people together through peer connection programs like self-help groups, the MS Friends Helpline and Paired program, and the National MS Society's Facebook community. To learn more, please visit the Society's website at nationalmssociety.org/connections programs. Every week on the Real Talk MS podcast, I continue the conversations that we start here. So I hope you'll take a few minutes and give Real Talk MS a listen. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. Walk MS 2021 is coming, and this year, Walk MS will meet you where you are to connect, celebrate, and make a difference like never before. For more information, please visit walkms.org. You can connect with the National MS Society along with others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. I encourage you to like those posts, subscribe to the channels, and make sure that you're on the Society's mailing list so you'll continue to receive the latest information on MS and updates on upcoming programs like this one. I'd like to thank Dr. Ross Tingen for joining us today. Please remember that a recording of this webinar will be available at the Society's website at nationalmssociety.org/msexpert, as well as on Facebook and YouTube. May is Mental Health Awareness Month, so throughout May, we're going to be focusing all of our Ask an MS Expert programs on cognitive, emotional, and mental health and how you can live well with MS. I hope you'll join us next Friday for Ask an MS Expert, when we'll be talking with Dr. Ruchika Prakash about cognitive wellness in MS and mind-body interventions to improve your cognitive and emotional health. And now I have a favor to ask each of you. Getting your feedback on today's webinar is important. So you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. On YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Ross Tingen and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.